senior radiographer coordinating the mobile aged care X-ray service. As you can see, the machine behind me, we have a digital mobile X-ray unit. We have a fleet of those available to us. The benefits of using our mobile machines are they're easily transportable. We can take them into the residents' rooms, and those residents can be high care residents, they can be low care residents, self-care residents. Basically, any imaging that we need to do, we can do in the patient's room. The benefit of that is the resident doesn't require transportation to a secondary imaging centre like an emergency department, one of our private practices on the coast, or even up to the hospital for clinic imaging.
Firstly and most importantly is it means that patients don't have to come into a busy emergency department when they're not well. And as you know, it's a scary thing at the best of times, but if you're elderly and you're used to either being in your home or an aged care facility, coming out of that normal environment is not a nice experience. So it means that decisions can be made, people can stay in that particular place, and they don't have to come to a hospital.
The mobile X-ray service provides great benefit to any older person living in residential care. Minimises trips to hospital, first and foremost, and that's probably the most important aspect of that. It's timely, and it also takes into account not everybody has the resources to go to a private pathology lab to have their X-rays done, but it also means for most people now living in residential care at a point where getting out of the building to attend is really, really difficult and places quite a bit of stress upon them.
Well, the service is really important because it brings care to people in aged care facilities, and that's really useful for those people who are in aged care facilities, but also for providers of care. It's excellent. So for GPs, this is not easy providing care in aged care facilities, but to have services like this coming into aged care facilities makes a big difference.
It's a great example of the primary health network and the local health district working collaboratively. I think those opportunities of organisations that are both state and federally funded working together so that we make it easier for the clinicians and the community. I think for me that's one of the other really big positives out of this initiative.
It does show that's really strong evidence around collaboration, and the LHDs can work with the aged care sector and can work with primary health network to get an outcome that has a huge benefit for the whole community, and in particular the person who's usually the one found on the floor, which is our residents or our older people.
This really puts patients at the centre of care. It's care in place at the right time, X-rays within 24 hours of referral, 5 days a week. This is what it's all about. This is what we should be doing in terms of joint commissioning to meet patient need. And what a great example. It's a fantastic service in aged care facilities linked with GP services and hospital services and other community services.